The university, RCSI, provides what is a kind of a synergistic approach to healthcare teaching. So pharmacists are educated beside their medical and physiotherapy colleagues, which gives them a very broad aspect on how patients are cared for. It's also a very technologically advanced university, so they are familiar and comfortable with the use of technology from the get-go. One thing that the School of Pharmacy particularly does is that it does review its performance, it reviews feedback from the students, and their reviews are taken on board, and checks and balances are put in place to incorporate what they have felt were the weaknesses in a particular course or lecture. The interesting thing is that they do a lot of work on teamwork. So there's a lot of group work where people may have to work outside what their comfort zone is, either on a topic or in a method of presentation. What we found is that the students, when they arrive to us, do have a very broad knowledge of pharmacy. They know what the different aspects of pharmacy are. They know what the other healthcare professionals do. They have a reasonably good working knowledge of how the Irish healthcare system functions. But more than all those things, they're self-confident. So they're able to hold their own, they're able to do interviews, and they're able to go into the workplace and work because their communication skills are at an advanced level. So more than anything, that is what RCSI students bring to the workplace, great communication skills. I would very strongly recommend the pharmacy course at RCSI. It's a very progressive course. It's always changing in response to changes in drug therapies. For example, we deliver a lot of the clinical courses from the pharmacy in the Mater Hospital, and the students know that what we're teaching them about is current practice, and current practice here. They have the depth of knowledge. The school understands that we're teaching them about a point in time. I think that that's a very important thing for any university. There's no standstill, and there's no acknowledgement of the fact that there aren't other ways to do things. There isn't a right or a wrong way. But with the communication skills that they do build up, they do have the knowledge to inquire as to whether something is right or wrong. And when they know that, they can then deal with all the rights and decide which of them is the most appropriate for any individual patient, for any individual institution. I think that's the strength, one of the major strengths of RCSI is it develops an inquisitive nature amongst the students. It's not just didactic.